Hi Cherika, I just finished reviewing your video and overall I thought you did really well. So I thought that you did a great job going over the pathophysiology of it. You talked about not just the macro effects of diabetes, but you also went into the micro effects and talking about what happens at a cellular level, so you went above and beyond with that, and great job. I didn't hear anything about the therapeutic considerations. I heard bits and pieces of it throughout the course of your video though. So I'm giving you a 2 in that category. With risk factors, you did a great job of going through them with the risk factors and comorbidities and explaining not just how it would affect therapy, but also things such as wound healing. So I gave you a 3 there. You did a great job noticing risk factors and things to watch out for with pharmacology and explaining with every medication, this is what I would watch out for. And so I thought that was awesome. You even went into talking about using the RPE for certain medications to give you a better read on the patient. With imaging and lab values, you did great in that category as well. You were able to notice the levels, but also notice if they were trending upward or downward and interpreting them. And same thing with the imaging. So you went into talking about what each imaging did and the results and how all of that impacts therapy. Red and yellow flags, you explained why each thing was a yellow or a red flag. And if it was yellow, what you would continue to watch out for to make sure it doesn't progress to a red flag. And you also noted that there was not any red flags at this time for physical therapy, so good job. With personal and contextual factors, you did a great job of going through and identifying them. However, I am going to dock you 1 point because I didn't hear much for the therapeutic considerations on these personal factors. For the systems, for the system prioritization, all that, you did awesome. So you went through and said, I would do these systems, and you explained why you would do them. You explained different treatments you would do, different outcome measures that you would use, what you would watch out for, such as, things like positioning and residual limb stuff, and the looking out for wound healing and integumentary considerations. So you did great with that. Now I was really impressed how you were able to put together like context clues, like saying that you would screen for depression and you would assess cognition because of the limb loss and the diabetes and this patient's age, but also putting together that this patient has been on bed rest, so you're expecting them to be weak, you're expecting decreased endurance and all that, so you did awesome with that. Your prognosis was great. It was patient friendly, but still very realistic. And you also noted that the patient was non-compliant, so you did a great job of tying everything together, and I thought your prognosis was awesome. And then overall, you were very professional throughout the entire thing, so I thought you did awesome. I gave you a 25 out of 27. Good job.